My name is Steve Lewis. I'm born and raised in Grand Rapids, Michigan, and so I recently joined South Florida Orthopaedics. I'm a board-certified orthopedic surgeon. My fellowship subspecialty trainings in shoulder and elbow surgery, so primarily focus on shoulder replacements, revision shoulder replacements, rotator cuffs, instability, kind of anything that involves the shoulder. I played baseball throughout my whole life and played in college as well. And so when I was 16, I was pitching and I had an injury to my shoulder. At 16, as most kids don't really know what they're doing. And so I knew I had an interest in science and anatomy. And so I went in to see an orthopedic surgeon. And he was probably one of the coolest guys and still a mentor to me to this day. I actually worked with him at my old job. He performed a shoulder surgery on me and was able to get me back to playing baseball again at the college level. And just from meeting him that one day, it was kind of, just something that the way that he changed my life. And that was something that just inspired me to go down the path of becoming a doctor and ultimately an orthopedic surgeon. Being shoulder specialty, we deal with a lot of elderly and shoulder replacements and arthritis and big cuff tears and all that, but you also treat the young patients as well. So you treat sports injuries in younger athletes just like I was treated when I was younger as well. And basically you kind of see shoulder issues at any age of life. So the varieties really keeps me coming back to work, and there's not much mundane or monotony. It's something that you never know what you're gonna deal with each day. And I love being able to treat all walks of life. Sounds cliche, but I do take the Hippocratic Oath to heart, meaning that, rule number one is do no harm. So, one of my favorite mentors, the one thing he really emphasized throughout my training was that, there's nothing that you can't make worse than with surgery. Meaning that I feel like I'm more conservative. And, I think saying no sometimes is the right answer as opposed to signing someone up for surgery. And so that being said, shoulder surgery, again, whether it's rotator cuff shoulder replacement or whatever the issue might be, there's a reason why we do surgery and there's a lot of indications for it. But overall, my goal is to maximize conservative treatment first, just because surgery, may not always have the best outcome, but my job is to give you all the options, and so that's why we maximize conservative treatment first, and then surgery is usually a last resort unless it's something more urgent. One of the reasons why we moved down to Florida is that we love to boat and we love to golf. So my fiance and I, we moved down here, and so one of the first things we did was buy a boat. And so we love to go out in the water. We like to fish. We golfing as well. We like to do. We played in a slow pitch softball team back home as well, and so we're hoping to get back into that too. And we do anything outdoors in Florida. The level of care that I could tell that patients, receive here is just different. And the way this group is run, it's just the compassion just from, top to bottom. Everyone, all the staff care a lot about the patients, and the care is thorough. And I have yet to meet someone that wasn't nice to anyone around them. And so I could just tell right away that this is an excellent group. It's patient care is the number one goal of this group. And so that was the main reason why I chose it.